Is dialysis considered, if you're on dialysis, can you be under hospice care, or is that considered well, it's not curative, but?
It's not. Now here's how dialysis works. If you're end-stage kidney disease, but you're on hospice for a different diagnosis. So let's say you have end-stage liver, because I have a gentleman now, he's end-stage liver disease, which is what we have him on hospice for, but he's also end-stage kidney. He's still on dialysis because we are taking care of him for end-stage liver disease. So if we can cover you on hospice for another diagnosis, you can still maintain your dialysis. But if the only disease process you have is end-stage kidney, then you can't be on dialysis.
I was kidding. They just give up on them? Then?
Well, that's what hospice is. That's what hospice is.
Yeah. Yes.
Do you get to choose the hospice care? Because you were saying there's differences between yours and maybe someone else.
You can choose. There's hundreds of hospices out there, and you can choose. It's choice. It's by choice. You can choose your home health company. You can choose your hospice company. You can choose. Medicare covers, and it's not Medicare replacement plans. Your hospice goes back to your red, white, and blue Medicare card. So as your parents or grandparents get these Medicare replacement insurances, and the insurance people tell you to throw those away, you'll never need them again, don't throw them away. You need them, because a lot of times you may have a grandfather that was deceased, and their insurance, their Social Security number is what covered grandmother. We need that number because it's a D at the end of it, like it was grandfather's Social Security number that covered grandma with a D at the end of it with the Medicare. We need that number because it doesn't pay, like a Medicare replacement plan does not, an Advantage plan is not what pays for hospice. It goes back to that red, white, and blue card that they got when they were 65. That is what pays for hospice care, and it pays it at 100%. So don't ever throw that red, white, and blue card away.
I didn't realize that hospice care had a certification period. Can you just sort of talk about that?
Yes. When hospice is ordered initially, you have a 90-day certification period. After the first 90 days, a nurse practitioner or a medical director comes out and does a face-to-face evaluation. That is good for another 90 days, so then you're 6 months into hospice care. After that second 90 days, you have unlimited 60-day recertification periods, and that is unlimited. And we've had patients on hospice care I mean, we took a lady that was on the other day. There was a hospice company that got shut down last Friday. She'd been on hospice care for 3 years, and we just put her on the other day. But she had unlimited 60 days and will continue on hospice care every 60 days with a face-to-face evaluation.
You had a client that was on hospice for 7 years.
If they qualify medically.
I'm just trying to tell people there are situations
absolutely
where it's not like the person will necessarily be gone in 6 months, and they could be.
They could be.